Down below Judy's priorities is the machine screen, and this is to help us to remember which drugs may be potentially inappropriate in patients of Judy's age. So you can see here all the fairly well-known flags for potentially inappropriate medicines in older adults, and particularly in older adults with polypharmacy. So you can see here, if we run along the top, each of these columns is labelled with the potentially inappropriate medicine screen. So you can see in this column here is an interaction checker. If you click on any of these headings, it'll tell you where the source is of this information. So you can see here that this is the Medispan interaction database, which is commonly used in clinical EMR software. If I click on the top of this column here, it says ACB. This is the anticholinergic burden, and it's not easy for us to remember exactly what these are, what symptoms they cause, or where the threshold is for when they might be being a problem. So if you click on any of these, there's information there to remind us as we see the patient of what's important about these particular medicines. So you can see here what the effects are of the anticholinergic burden on an older person: blurry vision, constipation, dry mouth. It might cause falls, it might cause cognitive impairment, all things that we see really commonly in older adults, and it's easy to miss that these could be the medications they're taking. And here it just is a reminder that the important threshold for anticholinergic burden is 3. If someone's got a score of 3 or more, then we should really be very actively looking at reducing that score by deprescribing some of the medicines. And down the bottom here you can see again the references to where this score comes from. If we look at the various columns, you can see they're designed not to be a snowstorm of text. So if you want to know more about the interactions, then you click on the tick. It'll bring up here the headline with a traffic light colouring to tell how severe this particular interaction is. So you can see here there's a potentially severe interaction, it's red, gives you the headline there. If you want to know a little bit more about it and how to manage it, then you can click on this arrow to the left, and it will bring up detailed information for what to do about the interaction, how serious it is, and if you scroll down to the very bottom, it'll even give you the supporting literature and studies that underpin this knowledge about this interaction. Then if you move, say, to the potentially inappropriate medicines column, which is drawn from a list from different countries around the world of potentially inappropriate medicines in older adults or combinations of medicines, if you click again on this tick here, it'll show you the detail of why this medicine may be potentially inappropriate, and you can then read and understand that in the context of Judy and her medical conditions. This column here is novel to the TaperMD tool, and this looks at the hypotension risk. So, as I previously mentioned, that too low blood pressure is a common cause for medicine adverse effects in older adults. And so this column here just flags the number of medicines Judy is on that might drop her blood pressure. Judy's got 3 ticks here, so this will prompt me to go back up and look at her blood pressure up the top. And when I look at this, I used to look at this as a well-controlled blood pressure. Now, in the view of the fact that Judy's on 3 medicines that drop her blood pressure, I'm thinking for someone who is 70, that this blood pressure of 110 is probably too low. So this is a pointer to some of the medicines that I could quite easily and simply deprescribe. Similarly here, this is a burden score, the serotonin syndrome score, and this flags the number of medications that might cause serotonergic side effects. I can see here that Judy's only on 1, but if she was on 4, then I would click on the top here and it would tell me what kind of symptoms it might be causing for Judy. Anxiety or agitation, sweating, tachycardia, and falls. Again, all things we see really commonly in older adults. So that's a good flag that looks not just at the side effects of one medicine, but the cumulative burden over a number of medicines that we can often miss if we just look medicine by medicine. In each of these columns, the hypotension burden, the serotonin burden, the anticholinergic burden, and the QT burden all operate that way. They give us a look across all the medicines all at once.